Pleasant day, everyone. We are Group 3 and our assigned topic is pneumonia. In our presentation, we will be discussing the disease definition, disease process, diagnostic tests, medical management, and nursing interventions.
An infection that inflames your lungs' air sacs or alveoli. The air sacs may be filled with fluid or pus or purulent material causing cough with phlegm or pus, fever, chills, and difficulty breathing. A variety of organisms including bacteria, viruses, and fungi can cause pneumonia. In the United States, common causes of viral pneumonia are influenza, respiratory syncytial virus, and SARS-CoV-2. A common cause of bacterial pneumonia is Streptococcus pneumoniae. However, clinicians are not always able to find out which germ caused someone to get sick with pneumonia. There are two types of pneumonia: community-acquired pneumonia and hospital-acquired pneumonia, known as nosocomial pneumonia. It may also be classified depending on its location and radiologic appearance. Pneumonia can range in seriousness from mild to life-threatening.
Predisposing factors are those that put a child at risk of developing a problem. These may include genetics, life events, or temperament. The predisposing factors of pneumonia are second-hand smokers, children who are 2 years old or younger, people who are age 65 or older, and weakened or suppressed immune system. Precipitating factors refer to a specific event or trigger to the onset of the current problem. Precipitating factors of pneumonia. The three main causes of pneumonia are bacteria, viruses, or fungi. The typical bacteria which cause pneumonia are Streptococcus pneumoniae, Haemophilus influenzae, Moraxilla catarrhalis, anaerobes, and gram-negative organisms. Several kinds of fungi cause fungal pneumonia, though the three most common are Pneumocystis, Cryptococcus, or Aspergillus. Infection occurs when spores of these fungi are inhaled.
For the disease process, pneumonia has 4 stages. Stage 1 or congestion occur within 24 hours of infection. Many bacteria are present in the lungs but few white blood cells are available to fight the infection. The lungs may look red from increased blood flow and swelling of the lung tissue. Clinical manifestations of pneumonia, it includes cough, fever, sweating and shaking, chills, shortness of breath, rapid shallow breathing, sharp or stabbing chest pain that gets worse when you breathe deeply or cough, loss of appetite, low energy and fatigue, nausea and vomiting especially in children, and confusion especially in older people. For stage 1 clinical manifestation, during the congestion phase, the lungs become very heavy and congested due to infectious fluid that has accumulated in the air sac. During this stage, your older loved one may experience early pneumonia symptoms such as coughing, a feeling of heaviness in the chest, loss of appetite, fatigue, and rapid breathing. Stage 2 or red hepatization occurs after 48 to 72 hours and lasts for about 2 to 4 days. The affected lung becomes more dry, granular, and airless and resembles the consistency of liver. Red cells, white cells, bacteria, and cellular debris can clog the lung airway. Stage 2 clinical manifestation: red blood cells and immune cells that enter the fluid-filled lungs to combat the infection gives the lungs a red appearance. Although the body is beginning to fight the infection during this stage, your loved one may experience worsening symptoms such as increasingly productive cough, shortness of breath, muscle aches, headache, extreme fatigue, fever, chills, sweating, and blue lips or fingernails due to low levels of oxygen in the blood. During stage 3 or gray hepatization, red blood cells will disintegrate during this stage, giving the lungs a grayish color. However, immune cells remain and symptoms will likely persist. This occurs on day 4 to 6 and continues for 4 to 8 days. The lungs look gray or yellow in color but still has the consistency of liver. Fibrin, hemosiderin, and red blood cells break down and lead to a more fluid-like exudate. Macrophages, a type of large white blood cells, starts to form. Stage 4 or resolution. This is considered as the final recovery stage and it occurs during days 8 to 10. Fluids and breakdown products from cell destructions are reabsorbed. Macrophages, are also known as the large white blood cells, are present and help to clear white blood cells or neutrophils and leftover debris. You may cough up this debris and the airways and air sac return to normal lung function. Any remaining lung swelling may lead to chronic lung disease such as airway narrowing or pleural adhesions. For the diagnostic test, the physician will ask about the patient's health history and do a thorough physical exam such as listening to the lung with a stethoscope. For chest X-ray, this helps your doctor diagnose pneumonia and determine the extent and location of the infection. However, it can't tell your doctor what kind of germ is causing the pneumonia. For blood tests are used to confirm an infection and to try to identify the type of organism causing the infection. However, precise identification isn't always possible. For pulse oximetry, this measures the oxygen level in your blood. Pneumonia can prevent your lungs from moving enough oxygen into your bloodstream. For sputum test, a sample of liquid from your lungs, or called sputum, is taken after a deep cough and analyzed to help pinpoint the cause of infection. For CT scan, if your pneumonia isn't clear as quickly as expected, your doctor may recommend a chest CT to obtain a more detailed image of your lungs. Pleural fluid culture. A fluid sample is taken by putting a needle between your ribs from the pleural area and analyzed to help determine the type of infection.
These are the nursing diagnoses: 1. Ineffective airway clearance, 2. Impaired gas exchange, 3. Ineffective breathing pattern, and 4. Risk for deficient fluid volume. Healthcare or medical management. Pneumonia treatment focuses on eradicating the illness while also preventing consequences. Treatment options vary depending on the type and severity of the pneumonia, as well as the patient's age and overall condition. Among the options are pharmacologic and hospitalization. Under pharmaceutical drugs, we have three common pneumonias: bacterial pneumonia, viral pneumonia, and fungal pneumonia. For bacterial pneumonia, antibiotics are frequently used to treat bacterial pneumonia. The antibiotic patients receive is determined by a number of criteria, including the overall health, any other health concerns, the medications that they are presently taking, recent antibiotic use, and signs of antibiotic resistance. For viral pneumonia, antibiotics are not used to combat viral pneumonia. Most viral causes of pneumonia have no treatment. If the flu virus is suspected, antiviral medicines such as oseltamivir or Tamiflu, zanamivir or Relenza, or peramivir or Rapivab may be administered to shorten the duration and severity of the disease. For fungal pneumonia, if a fungus is the source of the pneumonia, antifungal medicine will be administered. Next is cough medicine. This medication can be used to relieve coughing and allow the patient to rest. It's a good idea to keep coughing because it aids in the loosening and movement of fluid from the lungs. Furthermore, the patient should be aware that just a few studies have looked into whether over the counter cough drugs reduce pneumonia related coughing. Next, we have fever reducers or pain relievers. This is for fever and pain. The patient may take these as needed: aspirin, ibuprofen, or Advil, Motrin IB, and others. And acetaminophen are among them, such as Tylenol and etc. Talking about hospitalization, there are things to consider with regards to patients having the need to be hospitalized, specifically children and old age. Under old age, the patient may need to be hospitalized if he or she is older than age 65, is confused about time, people, or places, the kidney function has declined, the systolic blood pressure is below 90 millimeters of mercury, or the diastolic blood pressure is 60 millimeters of mercury or below, if the breathing is rapid, such as 30 breaths or more a minute, needs breathing assistance, if the temperature is below normal, or the heart rate is below 50 or above 100. Next, under children, children may be hospitalized if they are younger than age 2 months, they are lethargic or excessively sleepy, they have trouble breathing, they have low blood oxygen levels, or they appear dehydrated. These are our nursing interventions. Nursing care of the child with pneumonia in the hospital is mostly supportive and will involve routine monitoring and assessment of the child for respiratory status and oxygenation, fluid status, and sepsis risk. The child may require supplemental oxygen and SpO2 monitoring depending on the severity of the illness. For respiratory status and oxygenation, nurse should assess oxygenation and for the adequacy of air movement in lung fields, the presence of accessory muscle usage, nasal flaring, grunting, and diminished breath sounds at each routine assessment and more frequently if indicated. For fluid status, the risk for dehydration increases if the child is febrile. Careful monitoring of intake and output can help the nurse determine the risk for a fluid deficit. Supplemental intravenous fluids may be required. Then, for sepsis risk, routine monitoring for fever and risk of sepsis is required. Prompt initiation of antibiotic or antifungal therapy is required if the etiology is bacterial or fungal. If the child is determined to be experiencing sepsis, prompt initiation of a sepsis protocol should be initiated. Adhering to infection prevention standards, elevating the head of the bed 30 to 45 degrees to prevent aspiration, ensuring good oral hygiene such as cleaning teeth, gums, tongue, and dentures. Increasing patient mobility with ambulation to 3 times a day as appropriate, encouraging coughing and deep breathing, instructing patients in the use of incentive spirometry, such as most common type of pulmonary function or breathing test. And lastly, fluid intake should be maintained at approximately 3,000 ml a day so that the secretions remain thin.